and we love when you are a part of the conversation as well. And you can do that by the following means. You can send a message to us on WhatsApp 0809 4440981. 0809 4440981. That's the number to send your WhatsApp messages to. We are also streaming live on YouTube. Yes, you can catch the live stream at Smooth 981 FM Lagos. And you can also tweet at Smooth981FM with the hashtag Lagos Talks 981. All right, people. Now, the month of May is celebrated as Mental Health Awareness Month, and it's a month that mental health issues or mental health is put in the limelight. Now, in Nigeria, it's something that isn't discussed on a regular. It's something that some people tend to shy away from, but the month of May is dedicated to that, and we are going to explore mental health for this month. And the theme for mental health month for this year is anxiety. I know a lot of people have heard that word anxiety, and it has been bandied around by different people at different times. So, with me today to have this discussion is Adefunke Shonubi. She is the Assistant Program Manager, Mental Health Desk of the Lagos State Ministry of Health. She's also the Operations Head of the Lagos Lifeline, where she leads a team of professionals in providing telebehavioral health services to those in need. Very good morning to you, Adefunke. Good to have you on.
Good morning. Smart FM. It's nice to be here.
All right. Now, as I said earlier, we're looking at mental health. The month of May is Mental Health Awareness Month. Now, according to the World Health Organization in 2022, over 20 million, yes, 20 million Nigerians are currently suffering from various degrees of mental illness or disorders without any psychiatric care. Now, many Nigerians today, especially the youth, suffer from one or two mental health issues that are either being mistaken as quote unquote clout, or in other cases spiritual problems. Nigerians are very colorful people. Now, the most common of them are depression and anxiety. Now, I've heard those two those two terms being bandied about very regularly, in the past in Nigeria. And according to the World Health Organization, that's the WHO, mental health challenges affect a significant proportion of the population, with 1 in 8 individuals experiencing a mental illness. Now, however, this number may be higher as mental illnesses are widely unreported in many countries. So today, we're going to be having this conversation. We're going to have a focus on anxiety as well. So, Adefunke, can you tell us about mental health and why it's important to raise awareness about our mental health?
Um, Thank you very much. So mental health is. I always like starting with the definition of mental health, not by the textbook definition, but just in a way to get the layman's understanding of it.
Okay.
So a lot of people use mental health interchangeably with mental illness. And so when you say, oh, are you taking care of your mental health, or how is your mental health? Uh, the the immediate response you get is, oh, Olomaje, God forbid,
Classic
I don't
response.
have mental health. And it's like, no, I'm not talking of mental illness though. I'm just
Mm,
talking about your mental health. So the way I try to make people understand what it is just by using the physical health. Everybody has a physical health, but not everybody has a physical illness.
okay.
So when you're going to the gym and you're doing the whole fit farm and you're trying to eat to stay healthy, it means you're taking care of your physical health
Mm,
in order not to fall sick, in
okay.
order not to, have to go to the hospital or for any aches or pains. So you're taking care of your physical health, and you don't necessarily have a physical illness. So having a physical illness will say, okay, you have diabetes, or you have, AIDS, or you have malaria, or that kind of thing.
Mm,
And that's the way it is for mental health. So everybody has a physical health. It means everybody has a mental health, but not everybody has a mental illness.
so
So you
there's
take
a
care of your,
distinction there.
yes, that's the distinction. So you take care of your mental health in order to avoid having a mental illness. And yeah, so it's very important because I think in the last decade we've been seeing the importance of mental health in all aspects of life because when we talk of mental, we talk of the our thought patterns and how our cognition and how it affects our behavior. So
Okay.
when you're hungry, you're not yourself. When
Mm.
you're hungry, you're cranky. You just don't want to be disturbed until that food gets into your tummy.
Until you
So
until you
that
eat it.
exactly. So that your mental state because of your physical need for food has changed. So it has changed the way you're thinking, it has changed your behavior. So what I would present to you in that moment of your hunger, the way you would interpret it and the way you respond to it will be different from when you're completely full and you know you're okay. So the way you would respond, your response, your behavior to me or to whatever it is that I do to you would be different, and that's just how it is. So you can't separate mental health from any other aspect of life because it affects our behaviors, it affects our thought patterns, and that's why it is important to have this conversation, because the way we respond to behaviors, the way we respond to situations, the way we cope, our resilience, everything links to mental health.
Everything is tied in.
Everything is tied into, and it also shows even in the way we respond to treatment. So people in the hospital that are experiencing some sort of medical conditions, the way they respond to treatment, and you see some people saying, oh, he's you hear some physicians saying, oh, this patient is responding to treatment very well, and we can see that he's coping. It's not just in the physical, it's also in the mental, it's also in the
Mm.
I can do it, I can get better. And so the more you're taking this medication, you're actually getting hitting the milestones of the doctors. Yeah.
All right, interesting. Now, I'm going to circle back to what you said about Nigerians when you talk about, oh, how's your mental health, and they go with the classic, ah, God forbid, Allah magic, and all that. Why are Nigeria number one? Why is it that whenever Nigerians hear about mental health, immediately they think about people who have mental issues who are roaming around the streets, and also, why is it so taboo to have this conversation in Nigeria?
Well, to be honest, it's not restricted to Nigerians alone. It's a global thing where many people do not want to be associated with anything mental, and it's because of lack of an understanding. Now, there's this saying that what you don't understand, you mystify, right?
Mm.
So, mental health is a mystery to them, and what you mystify, you discriminate against. So, I don't know about mental health. The only thing I know about mental health is those who have visible, very visible symptoms of it, who are usually more often than not seen on the streets,
Okay.
in very deplorable conditions.
Mm.
So if that is the only idea I have of what mental health is, then I don't want to be associated with it. And more often than not, you see that it's mostly about family members who have all these visible symptoms of mental health are always left to their own flights. And that's why you see that, oh, they don't have care
Mm.
and they're just wandering about on their own.
Mm. There's this stigma that
That's the
surrounds them.
stigma, that's the discrimination, and it's because people do not understand it. So people don't understand it. You have to take care of your mental health from the get-go before it becomes so acute or so severe where seeking help. And some people don't even know where to seek help from. They don't even know that there is help for this kind of conditions. And for those who know that there is help for this, or they have some sort of hope for treatment, they don't know where to go to.
Another issue
Yeah, another
in
issue.
itself.
Yes.
All right, now let's talk about the theme for this year's mental health awareness month, and that is anxiety. Now, like I said, lately. I've heard a lot of people talk about anxiety, anxiety, anxiety. But what exactly is anxiety? What are the triggers of it? What does it represent? And how does one know that they're suffering from anxiety? Because I have a case here, but I'll let you go ahead first.
Okay, sure. Thank you. So, I know it more often than not you hear people say, "Oh, I have anxiety." The same way you say, "Oh, I have depression," and it's like, "Are you diagnosed?" You don't just use words like that anyhow. But anxiety is, just as you said, you quoted the WHO earlier, is just as common as depression. It's one of the most common, mental health symptoms, and it's easily overlooked because it's like, oh, I'm scared, or I have worries, or it's normal to, and the response you get is, it's normal to have worries. It is normal to have
Everybody
worries.
has worries.
Everybody has worries. But once these fears and worries become really excessive to the point where it's affecting your daily functioning,
Mm.
and daily functioning could be physical, it could be mental, it could be social, but it could be occupational. So once it's affecting your daily functioning, then it is a problem. And that's when you're now encouraged to seek help to get diagnosis. And more often than not, it's either one social, one anxiety or the other. So anxiety is a general term, but there are like different types of anxieties. And yes, so what distinguishes it from just regular fear or worry is that it has an impact on your daily functioning. So you're unable to function because of the fears and worries. Say I have I just started a new school, and excessively scared or worried that as to how I'm going to be received at the
Mm.
school.
How you would fit
And
into the
how
new
I'll
environment.
fit in, and then you see that I'm missing classes, I'm running away, or I'm hiding in the bathroom because I don't want to be seen. Now that is a problem because that worry is now excessive, and it's affecting my ability to sit in the classroom and do what I'm expected to do.
Mm, all right. Like I said, I actually have a case here. Now, in this case, I have a friend of mine. If I think she's the first person I actually heard anxiety from. And she told me that she suffers from anxiety. Now that I think about it, I don't remember if I asked if she was properly diagnosed, but there were certain behaviors that she would exhibit in terms of communication. Sometimes it will be difficult for her to respond to messages and so on and so on. But that's what she said, that she suffers from anxiety and it affects her in different ways. Now, is it possible, on the assumption that she wasn't properly diagnosed, let's assume that she didn't get proper diagnosis, does she have that right to say, I'm suffering from anxiety, or does she need to go and get herself checked out to be 100% sure that, okay, what I feel it actually is?
Yes, yes, she needs to get that professional help to say, my suspicions or my symptoms. I mean, you can have suspicions. If you're the kind of person that has multiple experiences with malaria, then you know when the next one has come. You know, okay, this is the regular symptoms I have from malaria. You read up online, but then you still want to go to get checked to know what kind of treatments to get. And like I said, for anxiety, there are different types. So which particular type of anxiety does she have? Like which symptoms fit into what type of the anxiety disorder? And that's why it's need for her to seek professional help to know the diagnosis and to get professional intervention. But yes, it is very possible. It's very like everybody reads, on the internet these
Mm,
days, and then you know what signs and symptoms. And if she knows that it's affecting her communication, which in some way that would mean that it's affecting her social relationships. So yes, then she knows.
mm. Interesting, very interesting. All right, Smooth 98.1. This is Lagos Talks. The conversation will continue on the other side of this short breather. Stay with us. Depression, anxiety.
Yeah.
If I got $1 for every time I've heard those two words being used, I would probably be balling right now.
I know,
People,
especially that depression. Oh, I'm
I'm
depressed.
depressed. I'm
I'm
depressed.
depressed. No, you're not depressed. If it's not affecting your functioning, you're not.
But they would want to claim that it's affecting their functioning, but this is their own diagnosis.
So the diagnosis is usually for like depression now, and that's why for anxiety I was saying there are different types. So there's
Okay,
some
so
where
we'll go
if
into the different types on after this break. Let's
okay.
go into that.
Okay, so there's some that the symptoms have to be concurrent for 2 weeks, two
Okay.
weeks straight. And you see some that the symptoms have to be concurrent for like 2 years straight. So if you're just having, you say
Two
today,
years.
today I'm depressed, and it's like, yeah. But if you're depressed every day for 2 weeks, for a period of no less than 2 weeks, then that is a problem. Then you need to go seek help, and it's most likely, depression. So that's how it usually is. But if I come today, I'm depressed, and tomorrow I'm all joking. 1 month, one day next month, I'm saying I'm, that's just sad mode. Like you're just sad.
A
So
temporary, a
it's a
temporary
temporary
thing.
thing. Yes.
Many people, a lot of people actually don't go to a doctor. They just go, and that is one issue I have with checking out symptoms and stuff. I've done it a couple of times, and most times what you get is you're going to die most of the time. So I
Yes.
try, I try to avoid it as much
Okay,
as
are
I
we back
can.
on?
You're back on.
Okay.
All right, welcome back. This is Lagos Talks on Smooth 98.1. You love music, love live station. You can be a part of the conversation. In fact, we love when you're part of the conversation. So you can join us on WhatsApp by sending a message on 0809 440 You can also give us a call on 014489 We're streaming live on YouTube. It's Smooth 981 FM Lagos. So those are the ways that you can be a part of Lagos Talks this morning. We're having a conversation about mental health, speaking about anxiety, anxiety triggers, and its management as well. And since it's Mental Health Awareness Month, it's a conversation that needs to be had. Bearing in mind that many Nigerians shy away from any issues that have to do with mental health or mental illness, because God forbid, and village people is what we usually get. And with me having this discussion is Adefunke Shonubi, Assistant Program Manager of the Mental Health Desk of the Lagos State Ministry of Health. She is also the Operations Head of the Lagos Lifeline, where she leads a team of professionals in providing telebehavioral health services to those who are in need. All right, Adefunke, before the break, we're talking about anxiety, and you mentioned there are different types of anxiety. Could you just give us let's dive into that. What are these types of anxiety that actually exist out there?
Okay, so the most common one is the generalized anxiety disorder, and that's when you just have excess worries for um, different types of triggers. And usually anxiety is like a trauma response, and so
Mm,
for it's like you've been exposed to something and it triggers a fear in you again.
okay.
And so generalized anxiety is usually like based on that. Then we have social anxiety.
Ah,
Social anxiety is just having the fear of being in social situations because you fear that you'd be judged or you'd be criticized, so you don't want to put yourself out there. You avoid parties, you avoid hangouts.
mm,
Your friends call you out, and you look for one reason or the other to stay back. It's just that avoidance of it. And then there's agoraphobia. Agoraphobia is it's a little different from social anxiety because that one is you just don't like being in open spaces.
with other people.
Yes, especially in you don't like being in spaces where you feel like you may not be able to get out of. Say you're in an airplane and you feel if there's an emergency you won't be able to get out of it
Mm,
immediately. So there's that intense fear
okay.
of it. And then we have panic attacks. Now,
Okay. I've
panic
I've
attacks,
had that as
well,
well.
it's panic disorder. Well, panic disorder basically is like, having very frequent panic attacks. So, panic attack is a little bit, it's a type of anxiety where there's no trigger. you're just in a place, in a situation, and all of a sudden you're having the palpitations. There's this intense, it's usually very intense, and then you're able to breathe. It's almost as if you're choking,
Mm,
and it lasts. It's very short. It can last like maybe 5 minutes, 10 minutes,
that's it.
and that's it. But if it happens very frequently, and the key here is that there's usually no trigger, so you don't know why it just comes. But if it happens very frequently, then that's panic disorder. It's very likely that it's panic disorder. And another one I would say, yeah, specific phobias. I'm sure you must have heard of claustrophobia.
Yes,
Yes,
agoraphobia, as you mentioned.
yeah, agoraphobia. So there are other like types of phobias here and there. Yeah, but the most common one of all these anxieties is
Mm,
generalized anxiety
anxieties.
disorder. Yeah.
Okay, now let me just I kept this in my head. You mentioned social anxiety. Now, do conditions such as, let's say, autism or Asperger's syndrome, are they kind of linked to social anxiety? Because I know like people who suffer from those conditions tend to be socially awkward and so on. Are they
Well,
similar? Are they linked somehow?
those are more neurocognitive kind of
Okay,
disorders because
okay.
it has to do with their neurological function.
Ah, okay.
I mean, all mental health disorders, all mental health issues have to do with the brain and the chemical interactions of the hormones in the brain, right? But those specific ones are classified under neurocognitive disorders.
Interesting. Okay. It's good to have you here to clear that up because when you have questions, it's always good to have someone in the know that can give you the necessary answers.
But like I said, most illnesses, most mental health disorders have like the one of the criteria is that it has to affect your functioning, and your functioning could be physical,
That is key.
social, occupational. Yes, so if it's affecting your social functioning, yeah, it doesn't necessarily have to be social anxiety, but it can be another kind of mental disorder that is affecting your social relationships.
Hmm. Join the conversation on Lagos Talks this morning. 0809 is the number to send your messages to via WhatsApp. You can also call us 0144899981. We're talking about mental health and anxiety specifically. If you have any questions whatsoever that you would like to ask our guest in the studio, that is Adefunke Shonubi. Thank you. Yeah, yeah. So, yeah, join us on the conversation, and we're also on YouTube streaming live. So, if you'd like to be part of that, you can head over to YouTube. Smooth 981 FM Lagos is where you can join us on YouTube. Now, looking at anxiety now, is it possible? Okay, okay, now let me put it this way. Uh, how does anxiety affect people who are living with severe mental illnesses? That's one. And another way I want to ask is it also possible for people to suffer from multiple mental illnesses at the same time?
Yes. So I'll
Mm.
take your second question first.
Oh dear.
Yes, it's possible to suffer from multiple. It's called comorbidity. So you have comorbid
Huh.
mental illnesses, and it's also possible to have a physical illness and also a mental illness. You know, and sometimes you have people experiencing depression, and then they would also have anxiety.
Okay.
Yeah, that's one example.
Wow.
Like you said, autism,
Mm.
right, can also have anxiety. There's some mental health disorders that are the likelihood of them being comorbid with another mental health issue is high.
It's high.
Yes, it's
Mm.
high.
All right, let's go to the phone line. Lagos, let's hear what you have to say this morning. Hello. Ooh, drop call. Please do also call back 0144899981. 0144899981. That is the number to call to be part of Lagos Talks this morning. All right, so it's possible to have depression as well as anxiety
Yes,
at the same time.
at the same time, yes, because depression is I know that's not the topic for today, but depression is typically like low mood, low self esteem, no confidence, hopelessness, worthlessness. Those are some of the symptoms. And if a person is feeling lack of confidence and they feel hopeless about the world, then they would most likely not want to be out there, not want to put themselves in situations where they may likely feel criticized. They would have excessive worries and they would generally have like a negative outlook of life. So they're always picking on the what ifs, the bad outcomes as against the possible positive outcomes. And that's how anxiety can come up because if they're always looking out at the possible bad outcomes, then they're always scared. It
Mm,
increases their intensity for worries and fear, and they just don't want to put themselves in those kind of situations. So it starts impeding their functioning. And
all right.
yes.
Okay. Let's
Mhm.
try this again. Hello, good morning. Hello. Good morning.
Good
What's your
morning.
name and where you calling from? All right, all right, Dari, we can hear you. Go ahead.
Yes.
Yes, we can.
Attacks. Oh, okay. Well,
All right,
ordinarily,
thank
I
you
would.
very much for that, Dari. All
Oh
right.
no, no, no. I would have said, I would encourage you to call Lagos Lifeline to because it would be good to also follow back on this. So you can call us on 090 9,000 6463. Okay, 090 9,000 6463.
Six
Six
four
four
six
six
three.
three. Thank you.
All right, thank you very much, Derek, for calling, and you have yourself a great day. All right, so like you mentioned, panic attacks and anxiety. I'm still going to circle back to panic attacks and anxiety as well,
Mhm.
because I've seen situations where people say they have these panic attacks, but panic attacks, are they panic attacks? Is it anxiety? You know, are they used interchangeably? Are they used wrongly? We'll go into that, but we'll need to take a quick breather. On the other side, we'll continue the conversation. It's Lagos Talks on Smooth 98.1. Many people are
This is
going.
people's chair for the guests. It needs to, so we need to be able to
Oh,
rest our
see,
back.
so sorry about that. Let's switch.
Am I doing well?
Oh yes, you are. Okay. Okay.
You need to change your chair.
Oh, please, I don't believe. Thank you so much. Thank
Is that better?
Yes, 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 yes. You said your name is Ayo.
Yes.
Okay. I was going to say, okay, thank you, Ayo, the other time, but then I wasn't sure if it
100%
was you
sure.
or the other guy who left. So I was like, okay.
This is Lagos Talks on Smooth 98.1. You love music, love live station. This is Ayo. And We're having a conversation about mental health and anxiety, and Adefunke Shonubi is with me in the studio. We're breaking down everything that has to do with anxiety, with mental health, and of course, trying to get beyond those barriers that a lot of Nigerians tend to set for themselves when it comes to mental health. Conversations that they don't seem to like to have, but conversations that are necessary for us to have. Now, before the break, the caller Dari, talked about him having a panic attack, probably. Now, for those who might have experienced what he experienced as well, and who are probably maybe too shy to call in or get across, could you just give some insight into what he experienced, just for their sake as well?
Okay, so I like how he mentioned that he there was no trigger because with panic attacks that's usually the problem. However, he did mention having an event coming up and thinking that it's overwhelming. So usually anxieties or panic attacks, that's what we're talking about, could likely be a response to stress because when we're overly stressed, our stress levels, there's a stress hormone called cortisol.
Mm,
So the cortisol level increases,
okay.
and once it increases, all sorts of things happen to our body. We sleep less, we either eat less or we overeat, and those on those are not really healthy. They're not good for our body, they're not good for our state of mind. And that's when all of these little aches, pains, and maybe panic attacks or mental issues and the crankiness, the behaviors now start to set in because we have not properly taken care of ourselves and our stress level is still at an high. And that's why we usually encourage people to take, to have self-care. I'm a preacher of self-care. Take care of yourself, make sure you're eating well, fruits and vegetables, make sure you're sleeping well. If you are working in a very stressful industry, make sure you get tiny pockets of rest. It
Mm,
doesn't have to be the 8 long hours sleep at night, but technically we should be getting 8 hours long,
at least.
at least duration of sleep. But if you're unable to do that, then make sure you're getting like pockets of rest or naps during the day if you can. Take breaks from your computer, you know, just find those healthy ways to cope. And some people say they cope with stress by listening to music, some people say they like to dance, some people say they just
They
like
have
to just
different
different, so
different
different
ways.
different ways of coping. So just make sure you find a healthy way of coping and avoid caffeine, avoid alcohol. Those things, when you're really stressed, they are not good for you, but they add to it. They
Mm,
don't help you. It's a very short way of coping that has a very long impact,
uh,
negative impact.
short-term benefits,
Short
but
term,
long-term it's not good.
exactly. Long term is not good.
Hmm.
So try to stay away from them.
Okay, now speaking of caffeine and so on and so on, there's a message here on WhatsApp from Emeka. Meanwhile, you can send messages into WhatsApp on 0809 You can also call 01 44489981. Join us on YouTube, streaming live at Smooth 981 FM Lagos. Emeka says, do psychotropic drugs lessen anxiety and panic attacks?
Well, so the treatment for all mental health issues are usually, there's this medication and then there's a therapy. So the type of medication and the type of therapy would depend on the diagnosis.
Mm,
So at this moment, yeah, it will depend on the diagnosis. It will depend. There are different factors, majorly the diagnosis, but also depending on the individual. Like your strengths and weaknesses and your ability to undergo that kind of intervention. So at this moment, I cannot say a yes and I wouldn't say a no as to whether psychotropic medication helps in anxiety, but it depends, and it's usually at the discretion of the psychiatrist or the mental health professional who is making that diagnosis. But an assessment needs to be made, and they would assess like different factors: your health, your history, the onset of the issue
Okay.
of the problem, the trigger, how frequent it is, the duration, and everything before they can determine what kind of intervention. Sometimes it's either the medication or the therapy, and sometimes it's both.
Hmm. So it's not a one size fits
It's
all
not a
thing. It's
one size.
dependent
Yeah, it's
on
dependent
on
on
the case
fact. Yes,
at hand.
yeah,
All right,
exactly.
Emeka, I hope that answered your question. Now, like I said, well, I was going to go back to panic attacks and anxiety. Uh, how do we distinguish, or how does one distinguish? Because one can say, "Oh, I had panic attacks," "Oh, I had anxiety," or "I had." Are they interchangeable here?
No, they're not. So yes, panic attack is a type of anxiety, but like I said, generalized anxiety is also a type of anxiety. So usually when people say I have anxiety, they are more often than not talking about the generalized anxiety. So panic attack is usually for a very short duration of time. Remember I said 5 minutes, it could
Hmm.
span 10 minutes. And the symptoms, that's the palpitations of the heart, the trembling fingers, you're sweating, you almost feel like you're choking to death, is usually very intense,
Wow,
like as intense as you would think that you're choking to death.
that's serious.
Yes, it's usually very intense, and after that span of time it goes. How But with generalized anxiety and any other type of anxiety, it's increases gradually. It's like, okay, I know I have exams at the end of the month. Right now I'm thinking of the exams. I'm already like, okay, oh my god, how am I going to handle it? But right now I'm still focused on other things. But as we draw closer to the exams, my fear, my worry increases. That's how generalized anxiety is. So as I draw closer to the trigger, then my fear, my worry, the intensity is steadily increases, but it does not get as high or as strong as that of panic attack.
Interesting. Okay, now let's paint a picture here. Now, assuming somebody has seen some symptoms and then has gotten, or is going to see a doctor, a professional, and they've told him or her, "Oh, you are suffering from anxiety."
Mhm.
Now, what are the possible treatment plans or means by which someone can deal with said anxiety?
Well, I spoke about the medication and the therapy. Those are for intense severe symptoms. There are also smaller self-care, self-help, interventions that they can do. Journaling is something we always encourage at Lagos Mind. We always encourage people to journal, because when you're writing your fears or your feelings or your emotions, you're writing it down. And I'm not talking of typing on the phone or
Actually, physically writing with a pen
physically
or pencil.
writing with a pen, because you realize that when you're writing your emotions with a pen, you're trying to elucidate how you felt in that particular moment or what led to it. By the time you go back to read it, you're reading it, it gives you a different light, it gives you a different perspective. And some, because I have done this before, so I'm speaking out of experience
No, it worked for you.
of just writing. No, you don't have to have a mental illness to journal.
No, no, I mean,
you
no,
know
no, I mean, and it was
yes,
therapeutic for you.
yes, it is
Oh,
therapeutic. You just
fantastic.
have to put in the work. That back then our mothers used to have like diaries, and at the end
Oh,
of the
yes.
day they
Oh,
write
yes.
what
Mm.
what happened during the day in the day. So it's more like that. And you just have to like be dedicated to it, be committed, like, okay, I'm journaling every day or every week, or whatever it is, what happens today. And it doesn't need to be like a long story. It could just be, okay, today this is what I achieved, this is what I didn't like about my day, and just put it in a jar, and say at the end of the week, every week you bring it out to read it, and you see that you're reading it from a different light. So it gives you a little bit
Mm.
more insight. You have like a different perspective, and then you're able to remember when next you are faced with that kind of situation. You're able to remember that, oh, this is a similar situation, and this is how I felt that time, and now you're able to redirect your emotions or realign your emotions and handle the situation better.
All right, let's go to the phone lines. Lagos, hello, good morning. Good morning.
Morning.
This is Lagos Talks. Welcome. All right, Frank, go ahead. right. Thanks a lot, Frank. Have a great day. Keep listening.
Thank you, Mr. Frank. So yes, the bulk of the work still has to do with awareness.
Mm.
Awareness, and the awareness is take care of your mental health before you have a mental illness.
But
We don't want anybody
it
to have a
but
mental
is
illness.
enough being done when it comes to
Unless
awareness?
more can be done.
Okay.
There's more that can be done. You know, and we need to pump it into people's minds that help there's help there's benefits in seeking help.
Mm.
You don't just have these issues and keep it to yourself. It's not going to help you. you know Seek help. Do away with the fears of being stigmatized or discriminated. It's only, what's that saying, a problem shared is
Is
a
the problem
problem
half solved?
half solved.
Yeah.
Exactly. So seek help, know the proper channels, know who to seek help, where to seek help rather. And that's when, if you feel like you're experiencing symptoms, and yeah, that's usually it. A lot of people don't know about mental health, like you said, and a lot of people don't know how to even come out to say, okay, this is what I am experiencing. And sometimes people even do tell, but they're telling the wrong person.
Ah,
So it's like, oh,
okay.
I have this issue, and you find somebody trivializing, like, you're telling me of your issues. Do you know what I went through yesterday?
That is exactly one thing Nigerians love to do. You tell them about an issue you have, and then they proceed to let you know, oh, that's a small
It's
thing.
like a competition of problems.
Why?
Yes. So they're telling the wrong person. And if you tell the first person who doesn't listen to you, you tell the second person who dismisses you, your willingness to tell the next person becomes really low.
Mm.
And it's like, you know what, nobody's out there to help me. But there are people out there. There are channels that you can reach out to, and yeah, just try as much to seek help. And I always tell people, when we're all surrounded by social support systems, our family, our friends, colleagues at work, you have different social support systems. It's important to know who your social support system is. Not everybody has the same capacity to support you socially. Some
Sure.
people are more informational than financial. So, if I need information about certain things, I know to go and meet Miriam. Miriam would always have this information. But if I know to, if I want to borrow money, Miriam is not the best person. So
Mm.
I'll go and meet Amaka. So you need to know who is, you need to know the strengths and the weaknesses of your different social support systems, so that when you're hit with situations where you need to discuss, some of your emotions or your feelings, you don't go telling the wrong person and then feeling disappointed.
Mm. I was thinking you were going to say when you need financial help, you come meet Ayo. I was ready to drop a disclaimer right there, right there. All right. So, okay, you mentioned that many people don't realize that help is out there. Many people don't know the right people or the right places to go to seek help if they're having one issue or the other they think could be a mental health issue. Now, where can people go? Who can they speak to? Who can they reach out to get help?
Okay, so Lagos Mind is one of the initiatives of the Lagos State's Mental Health Desk, and we started out the Lagos Lifeline, which is a tele-behavioral health service. So
Okay.
people can call over the phone and get mental health counseling or intervention, and depending on the severity or the acuity of their symptoms, then they can get referred to a consultant psychiatrist in any of the hospitals, state hospitals across Lagos State. Now, the reason why we started the telebehavioral health service is because we know that people are shy to seek physical help.
Mm.
They don't want to see you. They're more comfortable behind the phone. Because even sometimes when a person's their symptom is severe, and we say, okay, well, the intervention we're going to give you over the phone is not going to be adequate, and we'll need to refer you for, for further follow up. You hear them say, oh no, I don't want to go. Don't worry. And then when you keep doing follow up, like, okay, are you ready? Because, they need to be ready before they can see the second, for any intervention to be successful. The
Mm.
person involved. The affected person has to be ready.
Has to be ready and be assessed.
Yeah, and as in they have to be ready for that intervention. You
Okay.
can't force a treatment on a person. It wouldn't work because it has to do with the mind. So they need to be ready to seek that help. And if they're not ready, we can't force them to say, "Oh, we already booked an appointment for you. You have to go on blah blah blah." So they have to say, "Okay, I'm willing. I'm ready to see a psychiatrist or a mental health professional." And sometimes when we're doing this follow-ups, like, "Okay, are you ready? You know, sir or ma, these are the benefits and blah blah blah." They don't want to come because they just don't want to be seen. That stigma now, we have to take different levels or different we have to hit different walls to break that stigma to them for them to be able to. Sometimes we're successful, sometimes we're not. Sometimes some of them just recognize our phone number and stop picking the calls.
All right, now looking at this stigma that many people obviously face when they say, "Oh, I'm sorry, I don't want to come," and all that. How what can family and friends and support groups, I mean, how much more can they do to help to make it easier for people who are going through these kind of issues to be comfortable enough to come out? What role do they have to play in all
Oh,
this?
they have a vital role to play because they're usually the first point of contact more often than not. And that's when I talked about the dismissal of feelings and emotions sometimes. So, sometimes a person comes to you and they are talking about their emotions and you are not familiar with it. It's okay to say, "I don't know what to say. I feel you, I feel where you're coming from, but I don't know what to say to you right now. But can I just sit here and listen?" Listening alone is sometimes enough. Some people just want to vent. Some people just want to talk. Can I just
Express their
listen?
feelings.
Express. So let them express their feelings. And after expressing their different feelings, if you feel like, okay, I don't know, maybe we can research about it together, or maybe we can find, just let them know you're willing to find out more about their emotions with them, rather than just dismiss it and be like, "Well, I'm also going through my own, I beg you." So go through it with them. There's information. I know there's the risk of running into inaccurate information online, but there's also the benefits. And in Yoruba there's that saying, I'm not really, but there's this saying where you can't close your eye and let an angel pass or something. you know
I think I know that saying, but let me not expose myself.
exactly, I don't want to
Yeah.
expose myself to it. But you can't say because you saw the devil you close your eye and then several angels will pass by, that kind of thing. So there's a benefit of it. So it just takes your willingness to assess the person and say, "Okay, you know what, right now I can't really say what you're feeling, I haven't felt it before, but I empathize with you. Can we, maybe I can look into it, ask people, or if I know somebody working in the hospital, I can ask them on your behalf, is that something you would like?" And even if you don't know how to take that step, just listen.
That's the bare minimum.
That's a bare minimum. Just listen and don't dismiss it. Don't stop them, don't cut them short. And that's why you hear a lot of parenting classes. They'll say, when your child is talking, listen. Don't shut them up and tell them to go and sit down, and because then they start feeling dejected. Most of all of these things starts with
At a young age.
at the young age, and you'll see that the most mental illnesses start at the age of 14,
Interesting.
and it just doesn't come, except maybe the person was exposed to some sort of trauma that couldn't have been planned, motor vehicle accident, death of a loved one, abuse, except all of those. Some of it's from the little things, that we do. Absence of a parental figure, the way your parents talk to you, they put you down, they all of those things help in either building or diminishing confidence and self-esteem, and then the child grows with it. So when WHO says the mental illnesses start at the age of 14 or 15, it doesn't just come. It's something that has
Something
been
has
building up.
over the years
Yes,
up to
over
that
the
point.
years.
All right, man, it's been a fantastic conversation. But you mentioned a hotline earlier on, a way by which people who are seeking help can get across.
Yes,
Uh, can you give us that
phone
phone
number.
number again? How people can call in and seek help if they do need it.
Okay, yes. The name of the service is Lagos Lifeline, and the phone number is 090 9000 6463. So I'll take it again. 090 9000 6463. And we they can also you can also follow us on on social media, Instagram, Twitter, Facebook at Lagos Mind. And we have an email, info@lagosmind.org.
All right, you heard it, people. If you need any sort of help, if you're feeling a particular type of way and you need someone to speak with, someone that you can get information from, that's the number you need to call, because Lifeline is there for you. And on that note, we've come to the end of Lagos Talks this morning. Thank you so much, Adefunke Shonubi, for joining me in the studio. Once again, she is the Assistant Program Manager, Mental Health Desk of the Lagos State Ministry of Health, and also the operations head of Lagos Lifeline, where she leads a team of professionals in providing telebehavioral health services to those in need. Keep doing the good work.
Thank
And
you so much,
do have
Ayo.
yourself a
It was
wonderful
nice
day.
being here.
All
Thank
right,
you.
and we've come to the end of the smooth breakfast. Wow, 4 hours have flown by so quickly.